My biomedical device is on the ventilator and the endotracheal tube. To define a ventilator, it's basically a machine that mechanically assists a patient in the exchange of oxygen and carbon dioxide. So it's like artificial respiration. The outer appearance of a ventilator is that you see an endotracheal tube going to into their through their mouth and then opening the epiglottis and then allowing the endotracheal tube to go down to the trachea where the trachea and it's going to inflate and it's going to stay there while it's connected to the ventilator, and that's where the oxygen is going to give to the patient and it is controlled by the nurse, and the CO2 is going to leave and go into the ventilator. So basically, the function of a ventilator is to support breathing, but more importantly, to release oxygen to the alveoli for gas exchange, and to remove CO2 coming from the alveoli through the respiratory passageway. This is used during surgeries or if people need assistance in breathing. Looking at the pathway of oxygen going into the lungs, so basically it could start from the nasal cavity or it could start from the oral cavity, but let's start from the nasal cavity. So from the nasal cavity, it's going to go to nasopharynx, and then to the oral pharynx, and then to the laryngopharynx, where from the laryngopharynx it's going to pass the epiglottis and go past the larynx and then to the auditory tube, like the hole, and then down to the trachea where it's going to split into the primary bronchi. From the primary bronchi, it's going to become secondary, and then third bronchi, tertiary, and then it's going to keep going down until it gets to the respiratory bronchioles, which is going to lead to the alveoli. In the alveoli sacs and the ducts, that's where gas exchange is going to occur. So for the microanatomy, it's the composition of the membranes that you pass through while going through the respiratory passageway. So when you're going down that laryngopharynx, or it's like the split between like the esophagus and like the larynx, it's going with the epiglottis not allowing it any food to go in to like the larynx. So there around there's going to be stratified squamous, yeah, for food basically, and then pseudostratified ciliated columnar will be along the trachea of the bronchial trachea all the way to the bronchioles, moving that mucus upwards. And then there's simple squamous epithelium on the lining of the alveoli for gas exchange. Here you could see the simple squamous epithelium, or also called the respiratory membrane, where you could see that gas exchange occurring. So from the alveoli is going to give O2 to the red blood vessel because it's deoxygenated. So that deoxygenated is going to give out CO2 to the alveoli, and from the alveoli it's going to go all the way back out our mouth, or yeah, going through that respiratory passageway that we talked about earlier. Now let's look at the normal range that is measured by the ventilator. So it's going to detect breaths taken by the patient. So in normal range for breathing, or their tidal wave of volume is going to be around 14 to 20 inhalation, exhalations per minute. So that's the normal, but it also really depends on your age. So yes, that's another factor. So what is it actually monitoring? So it's going to be it's going to be checking on that the partial pressure of CO2, so carbon dioxide, pH, and H concentration. Here you could see um, the medulla oblongata right here, right? And here are your respiratory centers, the DRG and the VRG. So the DRG is going to have chemoreceptors that are going to detect that PCO2 or pH or H concentration based on the carbon dioxide in the interstitial fluid. So if there is high CO2s, it's going to send some action potential through the from the medulla oblongata down the spinal cord, and it's going to stimulate the intercostal muscles to contract. And that contraction is going to make fasten our breathing. So you're going to inhale. This mimics a ventilator because it's stimulating contraction, and it could also exhibit, like, not allow the contraction of these intercostal muscles or diaphragm by not stimulating it. So if there's a low amount of CO2, it's not going to stimulate it. So much like the ventilator, it's doing what the DRG and VRG do. So it controls if we breathe or not breathe, if we inhale or exhale. So here you could see that normal inhalation and exhalation. So when you inhale, that diaphragm is going to go down, while the intercostal muscles, the external intercostal muscles, will rise. So that's during inhalation. But when you see in not external, but exhalation, the air is going to be leaving. So your diaphragm is going to go back up and your intercostal muscles are going to relax.